Do we have everybody in the meeting? Hello? I seem not to be audible.
You are very audible, Dr.
You're audible.
Oh, okay.
Yes, we are waiting for some, but at the meantime, I think there are panelists that are there and participants. We can, if you are ready, we can be starting with the introductions and everything.
Okay, the participants are very few. If it is including us, I'm not sure if you want to, perhaps if we can start waiting for, at least if we can have 10 or 20, something like that. Because I see it's only 6 people in the meeting. Or maybe I don't know how it works as to how many people.
No, Dr. Digamela, there are in fact 29 people in the meeting. I think you're just seeing a small screenshot because you're on a phone.
Oh, okay. No, thank you very much. Let me take this opportunity to welcome everybody into this meeting. I was driving from Tembisa. I'm now in Mamelodi Hospital. We are doing oversight, but I will be handing over the role of my chairpersonship so that this meeting also become a success. I've got 2 honorable members. They are still on their way. They will be able to take over the meeting. I'm welcoming everybody into the meeting and the panelists in the meeting. I don't have a list of them because I was not ready for this one, but I'm going to welcome the first one. I think the first topic will be the lady who will be dealing with looting, the effect of looting on women in our country, the recent looting also. If you can introduce yourself, ma'am, you will be later be given an opportunity to tell us more. Tell us who you are and what you do, please. Osi.
Dr. Digamela, it seems as if the first panelist is not available. Can we move to topic 2? Meanwhile,
Yes.
we are still waiting. Yes, please.
Yeah, let's move to topic 2, which is dealing with I think vaccination. How is vaccination? What are the issues related to vaccination? You know, the attitudes, the perceptions that are there. Ma'am, you are welcome to introduce yourself.
Greetings, Honorable Chair and honorable members. My name is Nomfundo Ngwabe. I'm not too sure if would you like me to have my video on or am I audible as well?
Hello.
Yes, ma'am. I'm not too sure if can you hear me?
Yes, I hear you very well.
Okay. You can give indication as to when we can start.
Just introduce yourself as a panelist, as who you are, what you do. And please also unmute your mic and also your video so that you can be seen by those who are also part of us here.
Honorable Chair, I'd like to just confirm if you can hear me.
Yes, I hear you.
You are audible enough, Honorable.
I think, can we have the third speaker, because the second speaker seems not to be audible. Oh, there she is. Can you please tell us your name? And everybody in the meeting, we must just make sure we are muted. I saw someone on the video.
Yes, Honorable Chair, it's Nomfundo Ngwabe. I'm not sure if you can hear me.
Yes, I do hear you, Nomfundo.
Okay. Can I then begin, Chair?
Can we also, before you begin, come the first is the first speaker around? The one who will be talking about the grants.
Yes, Honorable Lidaba, I am here. My name is Tshebeletso Mageta.
Thank you, Tebi. What do you do apart from what you will be sharing with us?
Okay,
What else?
Let me try my video. I am the General Manager for Grants in the whole of Gauteng, in SASSA.
Thank you very, very, very much. Let me also introduce myself correctly. Sorry, I was hurrying to be here in the Mamelodi Hospital because they were waiting for us. I am Dr. Rebecca Digamela, the chairperson of the Portfolio Committee of Health in Gauteng. Let me briefly explain the role of the legislature. Is to do oversight in health facilities, and oversight in programs that are run by departments in Gauteng. We also are responsible as a legislature for public participation. What we do, we ensure that we involve the communities so that they are also part of what we are doing. The other thing that we do as legislature is lawmaking. It's important for us to come up with laws because as we living nowadays, nothing is static. Things are changing now and then, so the laws need to be updated or come up with new laws. The last thing that we do as legislature is cooperative governance. We are liaising and interacting with other areas, spheres of government in like your municipalities, national government. So we also have a role that we are playing there. The first three that I have mentioned, these are constitutional. So that's what we do every day. So I will be facilitating on behalf of the group that organized. Miss Lidwaba is not able to be here. So I am apologizing already that there will be some interruptions in between because I was like, I had to come in quickly. Can I ask the first person who will be talking about the looting? If she's here, if she's not in, can I welcome the second speaker who will be talking about a vaccine? You know, there are conspiracy theories around people are not taking vaccines, and all of us, many of us, we received the measles vaccine, and today we are still here. There are no problems. Please, if she's not in, the third one should come in, please. You need to just say something for the next about 5 minutes. You are given the platform, and then in those that are here, please do not let us those that are perhaps struggling, they will join, and the last one will be on grants. Who's going to speak first, because I can't see hands here. I'm welcoming the first one.
Should be Nomfundo.
Yeah, okay, Nomfundo, you're welcome.
Thank you very much, Honorable Chair and honorable members. I hope I am clear enough. As a mother, a woman, I am a survivor of the COVID-19 pandemic. I was hospitalized and put under oxygen. I shared a ward with my mother at the Charlotte Matlege Hospital. And this means 2 breadwinners were hospitalized. And this was a serious concern for my children. In this commission, we are assessing women's attitudes and perceptions towards the COVID-19 vaccination. Now, we have 2 breadwinners in hospital. I used to receive a call daily from my son, wondering how his mother and his granny are doing. My daughter overtook the role of being a mother. My brother was the driver, and every other responsibility that I would have undertaken if I was at home. You can imagine the stress that my children had to go through, let alone having to wake up in the middle of the night and I find my mother watching me with one eye opened. She prayed for me as she watched me breathe. We both made it out alive, and we can give testimonies. It was not an easy journey. Others didn't make it, and we thank the Almighty that we did. Taking the decision to be hospitalized was a collective one. We explained to the children that because of our promos, it would be easier for us to be hospitalized and be treated in hospital, and then they can recover safely at home because they were younger. And this way we kept ourselves safe. So many factors in our society and in our community as a whole play a vital impact on how we treat this pandemic. Social stigma being one of the biggest. Social stigma in the context of health is a negative association between a person and a group of people who share certain characteristics of a specific disease. In an outbreak like this one, this may mean that people are labeled, stereotyped, discriminated against, treated separately, and or are experience loss of status because of a perception that is linked to their disease. Such treatment can have a negative effect with those that have disease, as well as their caregivers, their families, their friends in the community. People who don't have the disease but share other characteristics with this group may also suffer from a stigma. The level of the stigma associated with the COVID-19 has been based on 3 factors. This is a new disease, and there are still very many unknowns. We are often afraid of the unknowns, and it is easy to associate fear with the others. It is understandable that there's a confusion, anxiety, and fear amongst the public. Unfortunately, these factors are also fueling harmful stereotypes, leading to the same attitude towards the vaccine. Now, vaccination, according to the World Health Organization, is a simple, safe, and effective way of protecting you against harmful diseases before you come into contact with them. It uses your body's natural defenses to build resistance to specific infections and makes your immune system stronger. I mean, back in the days when your children were younger, you would take them to the clinic for vaccinations, and you wouldn't question why, but you believed that they would help. Vaccines train your immune system to create antibodies. However, because vaccines contain only killed or weakened forms of germs, like your virus or your bacteria, that do not cause the disease and put you at risk of complications. So if vaccines are to help us and protect us against the virus, why are the people scared? Why are you refusing to be vaccinated? Or what is your reasons for accepting to be vaccinated? Or are we scared because of the myths, such as that vaccines are unsafe and normal safety precautions have been circumvented to fast track the authorization? Or is it because vaccines contain a form of microchip that could be used to track and control an individual? The big businesses are pushing vaccines to improve profits. Is that what people think? Or is it because that the vaccine may change your DNA? Well, you know what? These are all just myths. None of them have been proven. Successes of any vaccination programs largely depend upon a parent or an individual's perceptions and attitudes. The acceptance of a new vaccine depends on a complex interaction of factors, such as a parent's perceptions may vary considerably. The main factors that influence acceptance are the availability of the information for the vaccine and the cost of the vaccine. Therefore, for a new vaccination program to succeed, it should be funded by the government, and a specific public health or educational program should be undertaken. In actual fact, according to the latest stats from the Department of Health, the vaccination program in Gauteng is not doing badly at all. So far, in Gauteng, we've got 133,085 that have been vaccinated with the J&J vaccine, and we've got 1,881,674 that have had the Pfizer vaccination. Bearing in mind that this is a double dose. Unfortunately, a lot of our people in the clinics actually go for the Pfizer vaccine and say goodbye to the nurses, promising not to come back for the second one. Taking this further down and looking at how it affects the women. In total, when we look at the demographics and the age groups, between the ages of 20 to 29, 5% of those are women and 4% are men. The 30 to 39 gap, we've got 11% that have been vaccinated and 9% are men. The 40 to 49 age gap
Live streaming is on.
Is 13%, and for the male, it's 11%. And for the age group of 50 to 59, we've got 11%, which are female, and 10% being male. 60%, the age group of 60 and over, we've got a total of 15%, whereas 11% are male. In grand total, this makes it 55% of women and 45% of men. So we can see that as a province, we are not doing badly. However, let's take this to the metros. In Ekurhuleni, there is a plan in place. However, like all other plans, we do have a few challenges. And these challenges are collected from actually speaking to various stakeholders that one works with within Ekurhuleni. For an example, we've got a lot of unutilized healthcare facilities that could be used for vaccinations. We've got wards that are densely populated within our region, such as the northern part of Ekurhuleni. The distances to the vaccination sites play a vital role.
Ma'am, as you wrap up for the next minute or 2 minutes, then you can wrap up. Then we allow other members to also share. Thank you.
Thank you, Chair. So just as a wrap up, currently in Ekurhuleni, we've only got 232,870 females vaccinated. We would suggest and recommend opening up of more health facilities, using the SASSA sites as areas and means of vaccination, and also setting up pop-up vaccination sites, like in the taxi ranks, the shopping centers, and other outreach areas. So one can say that if you want to get back on the road, attend concerts, have big weddings like we do in our traditions, celebrations, or merely be happy, don't just do it for you. Do it for all of us. Get the jab, be vaccinated, and play a part in your country. I thank you.
Thank you very much, ma'am. Thank you very much. That is very informative and powerful to us, all of us, because we need to go around and encourage vaccination, and we need to address hindrances that are there to prevent vaccination. Let me also encourage participants that you're free to speak in any language that you feel comfortable with. I'm going to welcome the next panelist. I'm not sure anymore because she was talking about the vaccines. Now it means the one who will be talking about looting will be coming. If that she's around, she's welcome to share with us about looting. Hello. Yeah, I'm welcoming someone who will be talking about the looting. We've heard about the vaccines. If she's not in, can I welcome the one who will be talking about the grants during COVID? Are they sustainable? Are we getting help? Is it sufficient? Is it enough? Please, you're welcome.
Afternoon, member, and afternoon to the listeners. As I said in the beginning, I hope I am audible and that people can see me. Because I'm using my phone, I'll have to multitask. My presentation is on my laptop, so you'll pardon me if I lose the eye contact. As I said, my name is Sebeletso Mageta. I am the General Manager for Grants in the Gauteng region or Gauteng province. The commission or the theme It's the role of social assistance on the vulnerable women, with emphasis to the 350 SRT grants. However, during our deliberations and briefing, when we met with the organizers, I was saying to them, I find that a space or that topic very limiting. And I would have loved to take advantage and talk about the social assistance as a program of government in provision of social grants, and in particular in fighting the scourge of poverty, and how a social assistant holistically does assist a woman in particular, but I will touch to the specific on the issue. And I think the team say the theme was talking specifically in how we look at the stalwarts such as Mayor Charlotte Maxeke and the plight of Gauteng women in democratic South Africa under COVID-19. Realizing their role. If one looks at the issue around grants, they are highly regulated. And I'll just touch in terms of, for example, the Constitution, Section 27, and in terms of Section 27(1)(2) of the South African Constitution, where it talks about provision of health care services, including reproductive health care, sufficient food and water. And therefore, Section C in particular talks about social security, including those that cannot be able to support themselves and their dependents. The other legislative, we look at the Social Assistance Act of 2004 as amended. One also look at the Social Security Act, which is the act that established SASSA as an entity under Section 3 and as an agency of the Social Development Department. One also would look at the linkages in terms of the National Development Vision of 2031, which says SASSA should be responsible in the provision of the social assistance acts and services and the basket of services. So briefly, those are the legislation that underpins what we do on a daily basis. Now, coming to the topic of the day, how does the Social Assistance Act program empower women? If you look at the various grants that we provide, one would look at the old age. It empowers women because women also have the right to apply once they attain the age of 60, and they can after being screened. And therefore, we know that it has been proved that in most families, women live longer, and they are the breadwinners of the families. And you can see even in the statistics that women are more in numbers in terms of recipients of old age. The same when you look at the child support grant, wherein they can receive it on behalf of their children from the age 18, as a person can apply. And a child qualifies, we always say a child qualifies from zero. But in essence, what we mean is that from day one, if you're able, after leaving the hospital, and you are able to come and apply for a grant as a mother, you are able to come and apply immediately. Yes, also with disability grants, where women are found not to be able to work, then they are able to come and apply. Foster care grant, we know in most instances, people that take foster of the children, in particular after the pandemic of HIV and AIDS, a lot of orphans that were left were being taken care of by their sisters, by child-headed families, and aunts and related members of the family. So there has been an increase in terms of the foster care grant, and mostly we know that people that foster in our families are normally women, so they do also benefit. I've said about the child support grant, as well as a grant that I would love to encourage our women to learn about it, know about it. And that is why I found it important that I raise this. The care dependency grant is a grant that is given to a child who is unable to do anything for themselves, be it a child who is very sick, a child who has got a Down syndrome, and those children, if they are looked after by their families, a mother or somebody, they also can apply and they follow the process of a disability grant. Another grant that most of our people need to know, and some do know, it's what we call the grant in aid, and that is for caregivers, but it is applied to or applied on behalf of anybody who's being looked after by the recipient. If you've got a granny, a mother, a person who's bedridden getting a disability grant, the person who always look after then can be assisted. The person who is a social grant recipient, a gogo of 90 years, can then come and apply for a grant in aid. That grant in aid then assists the granny or the person who's bedridden to get somebody like a caregiver who can assist them, and they can be able to pay that person that grant. And that grant also is about 460, and it's a grant mostly that women would also come and benefit for. The last one within the social assistant spectrum is what we call the social relief of distress. The social relief of distress, it is where, for example, you are waiting a grant to be approved. And currently for now, we are also encouraging people where they've experienced the loss of employment due to the unrest in Gauteng, they can come and apply for the grant in aid. If they are not, for the social relief of grant of distress, if they are not getting any income whatsoever, and they have not applied for the 350. The grant, the social relief of relief, it's a voucher system. We give you a voucher which is worth 700 rand, and you go and get any food from Pick and Pay, the Spar, the Boxers. So it also can assist a lot of unemployed women and women that find themselves in distress, be it due to the unrest or the unemployment rates that are high. Lastly, within the social relief of distress, we also encourage and have, in terms of our operational targets, that we take a 30% of that amount. For example, in this year, the budget that we're given, it's about 58 million. And we take 30% of that and we give what we call...
As we close, ma'am.
Yes, and we give to co-ops to be able to women, and that covers women, and then it's available to women. Now, lastly, talking to the 350. The 350 grant, as we all know, it's open, and it has also been added to caregivers. And caregivers, we're talking the people that are getting the child support grant. Then they can also apply. While they're getting the child support grant, they can also apply for the 350. And everybody who has got a special permit, especially the people from Lesotho, especially from Zimbabwe and Angola. And we know all those mostly that are in South Africa are people that are domestic workers, and mostly they also can benefit from such. And in closure, I just want to say we need to encourage women, because women are the pillars of families, are the pillars of the households. And having lost a lot of income in Gauteng in particular due to the unrest, definitely as a government and SASSA as an agency, we definitely have products and programs that do assist, and people should just go there and request information, and these are out there to assist them. Thank you.
Thank you very much. Yes, when you give 350 to a woman, it is for the family. Thank you for that important information you have shared with us. I hope our participants, they are busy taking notes so that they will be able to raise questions. I'm already having a question for you, ma'am. Can I welcome the lady who will be talking about the gender-based violence? You are welcome, ma'am.
Dr. Dihamela is Mr. Ngomani.
Oh, I'm so sorry, sir. You are welcome, sir. But before I even go further, can I check if Honorable Makubela Lesiru is with us in the meeting? If he is in the meeting, I'm welcoming him to give message of support to the dialogue. But if he is not yet in, I just want to share with us here that it is very important for all of us to be involved, because when we are involved, we are able to identify issues that requires the attention. So it's very, very key. Can I welcome Mr. Ngomani to take us through the GBV during COVID-19?
Good day, Chairperson, and to the participant. Thanks for rectifying it. I am not ma'am, I am Mr. Ngomane. I work for Department of Social Development in Gauteng, but I'm also responsible for Men and Boys program. Thanks a lot for the invitation. It means a lot to us. Oh, perhaps I should make my mic on, not my mic, my video, because I see other speakers had videos on.
Yes, you are. When you speak, we need to see you, sir. Thank you.
Yes, no, perfect. Thanks a lot, Chairperson. Now I can see that I'm visible. I was still saying I'm responsible for a program of men and boys, and part of that program, it is to mentor young boys to be good and responsible and reliable citizens, but it is also to also engage men on issues of GBV and many other issues of families, of community development and spiritual upliftment. So what I would like to do is just to reflect on few issues according to a man's perspective on issues of GBVF. Because we know that GBVF, it's gender-based violence and femicide. We know that it also depends on a certain perspective, whether it's you take it from the perspective of feminist or a perspective of a victim or a perspective of a perpetrator. But we are taking it from a perspective of a man. Unfortunately, the majority of them are perpetrators of GBV. But it does not mean our members are perpetrators. Most of our members are either rehabilitated perpetrators or activists in the sector of GBVF. That was just a short introduction. I would like to zoom straight on the statistics of GBVF. Firstly, these statistics also suggest that South Africa is not only faced with one pandemic of COVID, but we are also faced with another pandemic of GBVF. Because if we check since the year 2000, according to Stats SA, we've got more than 2,700 women who have died in the hands of men. I know in one engagement early last month on Women's Month, this stats was questionable. Other people are of the view it's more than that. But my submission is that as government, you only rely on stats from Stats SA, and sometimes the media awareness around GBVF has made it so much that we at some time at some stage we will think the stats should be more than what it is, but for now it's 2,700 documented murder case in South Africa since year 2000, which is a big number. That is why we say one is too much. And we also see that 58% of murder victims in South Africa are women. 97% of them, 97% of rape victims are also women, and 65% of attempted murder, it's women also, and 72% of grievous bodily harm victims, which is commonly known as GBH, it's also women, and 83% of common assaults, it's also women. So the obvious question that we need to ask is, what is the cause of these terrible statistics in our society? Why we are such a violent society towards women? And normally these stats, when you say women, it cuts across age group. You'll find it's young women, it's middle age, and even older women. And you will see as I present the issue of older women, how it will come up as another important factor that we need to be worried about as a society. The cause, there are multiple causes to gender-based violence in South Africa, and our observation as men's movement is that the culture of patriarchy is a big problem, where men are growing up with what I will call natural rights of being supreme or superior to women in a society. So the culture of patriarchy is a big problem. Also, sometimes the socialization of a boy child, how a boy child is brought up, is mentored, and is exposed to life generally. If he is exposed to violence at a younger stage, that is why then it's important for us as adults or parents to monitor the games that young boys are involved in. If you, or even the movies they are watching, you know, if the language in a movie is not right, if the actions are not right, if the good guy or the main guy in a movie is always in a bar, that should tell you are socializing the boy in a wrong way. Then also other cases, it's just mental problems, because if you look deep in GBV cases, you can see that it's only a madman who can do that. For an example, you'll find reported cases of young children as young as 6 months, as young as 2 years being raped. From where we are, from where one can look at this, it's sheer mental illness. It's only a madman that can do that. And in other causes, it's what I will call a simple evilness. Because other GBV cases, when we get deeper into them, you can see that they've got an element of some spiritual sacrifice associated with them, where women are killed and their body parts are removed and all of that. So some of these causes, it's just evilness, evil rituals. But the last one,
as you are approaching closure, 2 minutes.
all right, I will try to be fast. The last one then is the issue of drugs and alcohol. But if you check all that is common in these causes of GBV is men. Men is a common cause, and we need to do something as a society. And indeed, as Men's Forum, I'm happy that you spoke about member Lisifo Makubo, because he's also doing something in transforming men in our society. So in transforming men, we've got a program called SA Men of the Year Awards, which we seek to profile and identify positive male role models And we also host men's parliament. This one is largely hosted by national department, where men are given a platform to engage on issues of GBV and how best they can improve. But for a boy child, Department of Social Development in Gauteng has partnered with Scouts SA. Our aim is to mentor as many boys as possible in Gauteng to be good and upright citizens in their growing up. But we also believe that churches have got a critical role to play, because we know that if there are some evil elements in GBV, then you will need also a spiritual war to fight those evil elements. That's where churches and their prayers are important. And lastly, Chair, it's to encourage the formation of men's forums in workplaces and in communities to make sure that South Africa is a better place for all of us. For now, Chair, I would like to stop here because of time, but let me stop by making two important quotations. One is that for evil to prevail, it takes a good man to do nothing. So that is why then we are encouraging men of our country to stand up against GBV. And the last one is that whoever knows what is right and fails to do it has committed a sin. That one is from the Holy Book called Bible. It's the book of James 4, verse 17. Thank you, Chair.
Thank you very much, Mr. Ngomani, for that insightful information. It's really much appreciated. We are getting serious statistics here that are happening, and women are bearing the brunt, and it is really bad because one woman take care of a lot of people in the household. The absence of a woman in the house is a serious problem in that particular household. Thank you for sharing with us. Can I welcome the person who will be taking us through the looting, how it did affect women? If she is present, can I get an indication? Looting, how did it affect women? If she is not yet here, we are going to move forward. And I'm also saying if Lesego Makubela, honorable member who is leading women in the legislature regarding the issues that Mr. Ngomane has just mentioned, I'm welcoming him in. But if he is not yet here, we've got 3 presentations that we have received. The first one was about vaccines. The vaccines, we need to address stigmas and perceptions. A lot of misinformation is going out there, and I am repeating, many of us here, we have received the measles vaccines as young children. We couldn't even identify it, that there were no issues. But now people have decided to come with conspiracy theories regarding the COVID-19 vaccine. I think that is not fair. It is incorrect. We from Ekurhuleni clinic this morning, we found a lot of people undergoing and getting the vaccine, and we were happy as a committee. As chairpersons of committees, we really were happy to see that the vaccine is taken up at that level, because they are at least giving about 500 to 600 vaccines a day in that facility. Now, if the lady to take us about talk to us about looting is not here, it means we've got the one for vaccines, we've got the one for the grants, and we've got the one for gender-based violence. I'm opening this platform for members of community that are participating here to raise hands, and the administrators will help me to identify, and then we take them one by one so that they can also share with us or raise some questions. My first question is, We buried my cousin last week, Friday, in Limpopo. Now, she left 2 young children. And now the children are now left with my sister, who is a lady teacher. Is she able to apply for the grants that are relevant for these children? Or is it now going to be a problem because she's a teacher, then she must now accommodate these young children? The clarity in that one will be very much appreciated. Are there any other hands that I can note?
My hand is up.
Yeah, Portia is up, Chair.
Sorry. Hello.
Yes, how are you?
Fine, and you?
I'm fine, thank you. For all the speakers, I have questions or something to say unto that.
Yes.
They have presented.
What is your name, please?
Portia Serote.
Thank you, Posh. You proceed.
I have a challenge. My challenge is that on each and everything that we are doing, we are dealing with assumptions without fact. The reason I'm saying this is with the first speaker was speaking about the vaccination, to say we are not vaccinating because of the chips, because we'll be controlled, we'll be robots. With me, it's a different story, and many people that have not yet vaccinated, we have a different story to date. And I will share the reasons why I, as Portia, have not yet vaccinated. These are the reasons that I have. It is not all about conspiracy theories, but it is because of mixed messages that it is coming from a government officials. And I will allude, why am I saying that? At first, it was said that if you have any chronic illness, you actually don't have to take a vaccination. However, along the way, that changed without rubbing off that and making us understand on what if that has changed, what research has been conducted, and all of that. And another thing is not a conspiracy. I watch Morning Live every day. We were told that 28 people died from the vaccination. Immediately after that, people came and then they told us that people who have died, they did not die because of COVID-19 vaccination. It was just a coincidence. Then the question that came is, but people went there being healthy, not sick, not having everything or anything, but they just died immediately after they vaccinated. That is a coincidence according to our officials. And it was also said that if you had COVID-19, you really don't have to vaccinate because you had the vaccine already, but because you had COVID-19 already. But that has changed, and education is not provided. Education is very important. The science of it, like we did with HIV/AIDS, like we did with TB, like we did with many other diseases that we had, so that people could understand and have a clear understanding. And I know and I understand that COVID-19 is novel and research is still unfolding, but mixed messages from the officials themselves is what is causing confusion. And then in terms of the second speaker, I do not understand how the grants, and first of all, I would like to thank the speaker for educating us about the grants that are in place. But however, I'm not understanding on how they are empowering women. In fact, as I'm seated here, I am believing that they are making us to be dependent on them, and it is not a sustainable way of resolving issues. I will quote Mandela when he went out of prison in 1994. He decided that, you know what, if we cannot.
You know, it is a video press mute.
Can I ask? Please, can you mute yourself? Please mute yourselves, please mute yourselves so that we don't hear you talking in private there. Mute, please. Mute so that Portia can continue talking. Mute yourselves, please. Mute. They haven't muted. Just a minute, Portia. By Melenyana, but mute. Mutang, Batung, mutang. Mutang. People, please, are tswaleng di mic tsa rena ra lutlwa ka moo. Can you please mute? Don't worry, Posh, I'll give you enough time. Can you please, can participants please mute yourselves?
I think Dr. is Millicent.
Millicent, Millicent, please mute your mic. You are interfering now this side, please. Thank you. Posh, welcome.
Thank you so much, Doctor. I was saying, I would like to thank the presenter for educating us about the grants that are in place. But the issue that I'm having is that, yes, we know for each and every legislation to be put in place, it is because they're informed by certain things. It is not wrong for people to get the grants, particularly your 350 and all forms of grants, because there are rights that are enshrined in the Constitution. But however, I'm not seeing how that is empowering women, but I believe that it is causing a dependency syndrome of some kind. When Mandela went out in prison in 1984, he realized that...
Yeah.
Can I ask Millicent? Can I ask Millicent to mute herself and they are talking background there? Please, Millicent, can you please allow the meeting to proceed without interference, please? Millicent, can you please mute your camera and also your mic? Thank you. Posh, you can, don't start from the beginning, continue where you were talking. Yeah.
When Mandela went out in prison in 1994, he realized that we just sit back there, we are provided with food, we are provided with blankets, we are provided with things without us doing anything. Then he just decided to say, we cannot operate on a residual and institutional approach, whereby people will just sit and wait for things to come to them. Because when that truck that is full of groceries is not coming, it therefore means it leaves people disgruntled and not knowing what is it that they're going to do so that they put the next meal on their table. On that day, he decided that we really have to operate at a social developmental approach. Social developmental approach was to say, let us give people tasks, that is knowledge, attitude, skills, so that people could beef up the economy of the country, so that people could do things for themselves. And that is a sustainable way of doing things. Because if maybe you are provided with skills and resources, knowledge, and attitude, it therefore means you can be in a good position to also create employment within your own vicinity, so that it was a sustainable way of doing things. So
as you close,
that is happening.
As you close,
that will give me time.
Yeah, well, I think, yeah.
In terms of gender-based violence, okay, as I close. As I close in terms of gender-based violence, you said you'll give me time, but I'll close. In terms of gender-based violence, we do not know the root cause of what is it that we are dealing with. And as much as we are empowering and as much as we are supporting women, I am worried of who is preparing the men to deal with the empowered women. Definitely, we don't know for sure. A research of some kind it is needed so that we know what is it that it is causing these men to abuse women. Because it is not so long. The president has said, if you have raped, if you have abused, if you have done whatever, you will go to jail for 25 years and. But instead of the statistics going down, we are only seeing statistics going up and being aggravated. So we do not know. All our interventions are failing. Psychosocial and psychological issues are not looked at. People are having scars and wounds, and they feel better when they revenge by doing that. So if those issues or research of some kind could be done, the speaker said it very clear to say, with our observations, with facts here, we can't just work on assumptions. That is why all our interventions, therefore, are not informed, because we work on assumptions, like the first speaker who has said we are seeing that people, it is because of conspiracy theories. Research will assist us to deal with the issues that are affecting people directly. So thank you.
Thank you very much, Portia. Thank you. You've made your points, and I think we have heard you. Thank you very much. Posh, can you mute yourself? I think I saw the hand of Wendy. Wendy, is there Wendy? Is Wendy or is it I think it's the surname I saw, another surname Chia. Can I welcome those who want to speak to come in? Mutau, you're welcome. Unmute your mic and your camera to speak, please. Mutau, unmute, then speak.
Hello, everybody.
Hi.
I'm Mutau, and I'm from Access Chapter 2. I wrote my question. I'm sorry, I cannot remember the name of the speaker who presented on GBV. If it's okay, Chair, I'd like to read it. I would like to ponder on something where prayer has not aided in Black lesbians and transgender women being corrected for correctively raped as an act of violence specifically aimed at them because they are women who must be converted, whether it's because of their sexual orientation or their gender identity. For me, as a result of what these rapists who rape and believe that in raping them they will convert them, I would like to ask you, great panelist, is it not the enactment of patriarchy in the brain which should be the main focus of behavior change interventions? Because we're saying patriarchy, but that patriarchal culture, that culture of rape, is enacted by human beings in the brain. And would it not be more helpful to enable us eventually to move from merely preventing rape and actually starting to what does the end of its behavioral enactments look like, you know, and coming to see its end, you know, outside of just merely saying it's patriarchy, but saying how can we go and address in the brain, if our interventions can go focus specifically on the brain and saying how can we work with the brains of men and boys and children, but I mean the brains of everyone who enacts harm to others. I thank you, my chair.
Thank you very much, Mutau, for that question. Is there any other question or comment? Is Honorable Lesego in the meeting?
I don't know if you can hear me, but I'm in the meeting.
Yeah, we are now on the questions for members of public to raise questions. I will allow you just after their responses to give a message of support, sir.
Thank you very much, Doctor.
I hear you well today. Is there any other question?
There is a hand from Tembagazi.
Tembagazi, you are welcome. Unmute your mic and also your camera and speak. Noku Kanja, you will follow. Tembagazi, speak.
Mina bengicela ukubuza owami umbuzo ngiwubhekisa kulo sisi lo obekakhuluma ngevaccine. Akithi eSouth Africa we have rights.
Yes.
Umuntu makathatha umntanakhe ayomenza immunization yabo polio and stuff. Umthatha ngoba unama rights, uyathanda ukuthi ayoyenza. Why when it comes to COVID vaccine we are forced to do it? Because the government says we are not forced, but due to indlela ekwenzeka ngayo, because they give us the ultimate time yokuthi if you are not vaccinated you are going to be fired. Then where are our rights? Esikolweni uthola ukuthi iyekiwe imithandazo because kuthiwa kunama rights, kunama religion a-different, angithi ezijini wabo a-different bakhonza ey'nkonzweni ezahlukene. Then if mina inkolo yami iyala ukuthi I must get vaccinated. Where are my rights? Because angithi nginama-rights. Manje kusho ukuthi awami ama-rights akho inkolo yami isebenza esikolweni kuphela ukuthi angingathandazwa, but ayisebenzi okuthini mina as a South African citizen I don't want to get vaccinated because inkolo yami ithi mina ngikholela uJesu ukuthi uyangiphilisa. I don't get vaccinated, I don't get medication in my body. I'm using the blood of Jesus. I believe to Jesus only. And as a Christian, we believe that there's 666, there's Satanism and stuff. Why they don't allow us to do what we believe in? Why they give us ultimatum that everyone must vaccine?
Okay, thank you. Are you having another question, Thembi?
No, bengekaqedi because bengifuna ukubuza ukuthi like ngoba ngibona ukuthi i-statistics ebantwini basemakhaya sikhuphuke kakhulu. Are they educated enough? Are they know ukuthi yini le bayenzayo? Ikhona indawo la abantu ba-educate-wa khona except ukuthi they are forced to take vaccination whether they like it or not. Like inkinga yami ukuthi labantu le statistics esikhuphukayo, are people educated enough to understand the vaccination? Because polio siya-understand ukuthi izokubuyela sewumdala uxhwale wenzeni, but COVID we don't understand ukuthi i-protector kuphi if I will have i-COVID even though I vaccinated. Like ngathi singathola more education even in parliament because ngathi nabo abayi-understand. Because kuyashonwa, if ushone before uba ne-COVID kuzothiwa ushone nge-COVID, but if ushone so-vaccinated kuthiwa ushone ngesifo sakho. Kuthiwa kwe-government 28 people bashonile wathi izifo zabo, but if bashone before ba-vaccine kuthiwa usoyamene we-COVID. What is soyamene?
Okay.
Inkinga yami leyo.
Okay,
ngiyabonga.
thank you, Thembakazi. Questions wako are straightforward. We hear you. And then can I take Nogukanya?
Greetings.
Hi.
Hi.
Yes.
Mina ngila kule commission gender based violence. I-question leyo ukuthi are women adequately informed of the support available for victims of gender-based violence? My answer is the support for gender-based violence victims in the local areas tend to have facilities with judgmental staff, including the health care and the police services. And the other thing is that the government give us the brigade to assist us with the gender-based violence, but ama brigades lawa ayashoda. It's like we have only 8. We have only 8 brigades la eTsakani, and they report the cases police stage, but ama cases wakhona and apha aphelela endleleni. So abantu laba abareportayo kuma-brigadiers nabo ba-end apha bangasenalo ithemba kuwo lama brigadiers asebenziswayo u-government. And the other thing, we don't have ama-green doors in our areas, and i-community ayazi ngalama green doors because akuna advert mhlambe or most of the time kube khona la sizathi masihamba sifundiswe ukuthi there are green doors to help amantombazane abomama laba abahlukumezekayo. Then question number 5, are victims adequately supported within the criminal justice system? My answer is the fact that every cases need petition to persuade the investigators and the court. It's very alarming. Cases must gain popularity in order to dealt with accordingly as a major problem. E.g., there's a case eDavidton. I-case number yakhona it's 180/3/2021. I-case kaSibongile Msiza, where the perpetrator uBahle Mthetho has received bail after he was on the run for 4 months. When police caught him, the magistrate gave him a bail within a month in custody. Leyo nayo yenye ebonisayo ukuthi asinayo inkolelo kakhulu kuyi-government nakumalutozana ama-department lawa alisana ne-gender-based violence. Thank you.
Thank you very much, Nokukanya. Are there any other hands before we move on to responses by the panelists? In the absence of any other hands, I just also want to say the vaccine is not, nobody, vaccinate. It is not compulsory to vaccinate, but we encourage vaccination. And the other thing is, when a child goes to the well baby clinic and the child is not well for that day at the clinic, temperatures are taken. If there is flu, high temperature, fever, and all those kinds of things, the child will not be vaccinated. So our elderly people or all of us, when we go to the vaccination site, we must report every illness that we have. If you've got a comorbidity, you still will get a vaccination. But I am not taking words from our panel member. She will come in and also speak. I just needed to say, yes, nobody is forced to do vaccination. I'm going to now welcome our panelists. We will start with Ma'am who presented about vaccination. I hope you were able to get the questions raised by our participants. You are welcome, ma'am, to respond. Then I will take the other 2 panelists thereafter.
Thank you very much, Honorable Chair, and I greet the honorable members once again. Honorable Portia mentioned that I stated that people are scared to be vaccinated. It was indicated that this is a myth, and the pointers that were raised were myths, and none of them were proven. This was just a highlight as to why people actually are scared to go out there because of what has been relatively been said. And for those people that have passed on due to COVID-related matters, like you said, these were mentioned from people that work within the health sector. Unfortunately, one thing that I have picked up when I've had discussions is that, when people pass away, we're not given an opportunity to take the corpses and take them for autopsies and actually find out if are these actually related to the vaccination that was done, or alternatively, was it some other hindrance that caused them to pass away. One thing that I can suggest, which was part of my presentation, is that are you a vaccinator? Make sure that you do not have a fever, that you're not coughing, that you don't have a runny nose or any of the symptoms that could be related to COVID-19. Make sure that you're not waiting for test results. Okay, you've tested positive in the last 30 days. Okay, you've been in contact with somebody and you've been in quarantine. However, what we can advise is that eat something before you go for vaccination, because abantu react differently. Xabe nervous. And then constantly make sure that you are hydrated. It's advisable that you also take paracetamol or Panado. However, please do not take grandpa. Grandpa. And that is very bad for you. And once you've been vaccinated, rest. We do have a hotline that can actually help you with that, which is the COVID hotline, which their number is 060-012-3456, and they can also help you for that. And another alternative that the government has now allowed is your rapid tests, which was part of my recommendations to say when you go for vaccination at the sites, they should actually have a rapid test, which is one of those tests like the HIV test where you prick your finger and then batesticas lauco if you do have the antibodies for COVID. And then that way we would know whether you are eligible or not. Honorable Tembagaze beteta ngabantu who need to be forced for vaccination. As the Honorable Chair, the doctor has mentioned, nobody's forced. It is your constitutional right to actually decide whether you want to be vaccinated or not. However, what I can suggest about if I'm vaccinated, it's within your rights to go to CCMA and speak to them. One thing that is currently being tested is a mechanism called the herd immunity. Now, herd immunity works in densely populated areas where abantu abaninzi xa vaccinated. It's highly possible that a variant that we do have within the COVID space does not actually reach out to everybody. And for an example, if you look at the street children or the Nyaupe boys, that a lot of us question about why are they not getting sick? The people that stay in closely dense places, like in Davis Fananoka, like in Davis
Please mute your mic.
Mute your mic, Doctor.
Now I'm staying here. Sorry.
Doctor, your mic, please.
Dr. Raogo. Dr. Raogo.
Apology because I told you I'm double booked, but I apologize. I'm so sorry.
Okay.
Not a problem, Doc.
Please proceed, ma'am. I'm sorry.
Not a problem, Doctor. Understandable. The herd immunity is one thing that can actually help us to come back to this virus, which is why we suggest that a lot of the vaccination sites are now put as pop-up centers in the informal settlements. But in conclusion, as Dr. Kize once said, as a nation, we've experienced great suffering at the hands of COVID-19. However, together, we have weathered such a storm as we've last seen over the last century. History peppered us with stories of loss and pain due to the terrible effects of the plagues and the disease. These stories, like ours, are heavy with the wreckage of social upheaval, economic decimation. Abantu balahlekelwe ngumsebenzi. Abantwana khange bahlale abantwana bahleli khange baye esikolweni. That affected a lot of people. And psychologically, it was scarring. Baninzi abantu abangazazi ukuba xa bevuka ekuseni bazawuthini, bazawenza ntoni. Nihlala sinemibuzo ukuthi kwenzakalani ngoba singazi ukuthi lento le izosiphathelani. However, it is said that in a crisis, one must count one's blessings. One of our many blessings has been the scientific advancement we have made in medicine that has brought us vaccines barely after a year after a new virus has evolved. Ndiyacela bantu Nkosi, let us go and vaccinate. Nkosi.
Thank you very much. What about 90 days? Akiri, there was this issue that said if you were positive, you must wait for 90 days before you can get the vaccine. Can you address that one, my dear sister?
Apologies, Chair, I might have missed it. However, it is not 90 days. It has been updated to 30 days. I know a lot of people have had the perception that it is 90 days. It is actually 30 days. And one thing I could also advise people is that when you have tested positive for COVID, please don't keep it for 10 days. Rather count 14 days and you start counting on the first day of your symptoms. A lot of the time, people actually don't understand about COVID incubates in your system before you start showing the symptoms. So instead of the 10 days, to be safe, rather count for 14 days. Ngos.
Hello, can I welcome the presenter on GPV, Mr. Ngomani? Can you respond to those issues?
Yes, thanks, Chairperson. I will take it that some were comments and I will just note them. But firstly, on the issue of assumptions on the causes of GPV, it's not assumptions. As government, our data is based on research. And if you can go to our website and even to the website of Gender Sonke Justice, you'll find that a lot of extensive research has been done on causes and effects of GPV. I think the last research was on the economic and financial implications of GPV in the economy in general. So a lot of research has been done. You can visit that CISPOSHA, those sites, our websites or Gender Sonke Justice sites. And also Stats SA has done that. But on the issue of prayer and corrective rape, if I got it correct, it's a difficult one. Other churches, I must say that they are supportive and understanding to the gay and lesbian community, but others are not understanding and are hostile. So it will be important, therefore, not to undermine the role of the church and the role of prayer in fighting GBV, because as I have said that where there is a spiritual evilness, you can only fight and win it through spiritual warfare, through prayer, fasting, and supplication. So there is that strategic role of prayer in fighting our problems. And also on ending the patriarchy in the mind of a man or in the mind of a society, I'm of the view that South Africa needs to dwell much on peace studies. You know, we need to make peace studies a subject in our schools and the issue that can be discussed and have those meaningful conversations about what makes a person in the society peaceful and how do we do that. Let us have peace projects and peace conversation so that there is a deliberate effort in instilling the culture of peace and understanding in our society. As much as patriarchy come through training, come through exposure and practice, also peace efforts need to be done. So we should not see peace as a signing of paper and shaking of hand, but a peaceful behavior and society comes through training and practice. So that is my personal view. That is my personal perception, because countries like the Scandinavian countries which have got peace studies, you can see their level of tolerance and understanding is very high compared to that of violence. Then on the issue of of GBVF brigades, I concur with you. More needs to be done. And you know, people, our country needs to partner with government. If government can afford 10 GBV brigades in Tsakane, the question is, what is the community of Tsakane doing? Why don't we have young people who are unemployed also volunteering to add to that GPV brigades? The mentality of what is there for me in our community, we must discourage it. People should say, I've got time, I'm not working, let me add, let me be one of those GPV brigades. I will learn, but I will also help my community. So let's partner people with government, because we know that government can do so much, but we also need to assist. And also the issue of police of Tsakane, I'm sure the members here have noted it. The chairperson is a member of legislature. I'm sure she will raise the issue with the portfolio committee on safety and security. They will follow up on the case number that you have raised, sister. And the issue of green doors, I agree. I concur, colleagues. I think it was a comment that we need more information. It's these meaningful conversations. We should also start these conversations in our own communities. And that is why I was saying we should encourage the formation of men's forums so that men are also part of the solutions. But also we should form women's forums and girls' forums in our townships, so that then there are these meaningful conversations, but also information sharing and implementation of what is right in our communities as a result of being well informed. The issue of justice system, I think it was also a comment, but I'm saying in future, maybe it's a good proposal that in future in these conversations, let us have Department of Justice, because they are a very critical role player in fighting gender-based violence. And same with Department of Correctional Service, because Department of Justice sometimes send people to jail, but when they get in jail, they are just given parole and they come back quickly. So you can't have a complete gender GBV conversation without roping in Department of Correctional Service and that of Justice. Chairperson, I think I have responded to the questions and to comments I would like to pose there. Thank you.
Thank you very much, Mr. Ngomani, and I deeply apologize for that noise. I was beating the hospital bye-bye to release also people to go home after a successful oversight. So let me welcome my dear sister, the one who will be talking about the grant.
Thank you, Chair. I will respond, and I think the questions, if I recall, there are two. There was the first one, which you said the lady was saying her cousin sister who just passed on, leaving 2 children, and one of the caregiver currently is a lady teacher. With the child support grant, unfortunately, you might find that the lady teacher, because of her income, might not qualify. However, through the foster care system, which is not means tested, then the lady teacher can go to offices of social development and request fostering of those 2 children, wherein after the process is taken to court, and the court then, if it be, she be given the rights to foster her children, her sister's children, then she can be assisted with applying for a foster care grant. The foster care grant, it's not means tested. It does not take into consideration whether you are working or not. Hence, we always say, if it's orphan children, we encourage them to go for foster care, which is under social development. Then once they get the foster court order, then they can come to SASSA to apply for assistance. Alternatively, as a family, they can look at an alternative caregiver, be it the very speaker who was asking for the question, or a relative whom they know is not working, that can apply in the meantime as what we refer to an alternative caregiver, who can then apply for the child support care grant for the 2 children. The questions coming from Portia, which is very interesting. I liked it because she looks very young. That are we not creating a dependency on the provision of these social grants? Yes and no. When government took over after 1994, the situation in South Africa was that there was a lot of disparities. If you look at the child support grant, it's replacing what in the days of my early starting of work was called the maintenance grant. And the maintenance grant was only provided to the white people and color. Anybody who was an African did not receive those. So our new democratic government, in also trying to bring a democracy and equality in terms of services in government, introduced the child support care grant. After that, we had a program that were called the linking of the social grants beneficiaries to economic opportunity. Can we ask MM to mute? Can we ask the participants to mute, colleagues? Thank you. The government then had a project where we're linking the child support grant recipients to economic opportunities. We had NGOs at the time, the pilot in 2015, 2016, we were using a organization called Lima. And I know in the areas of Bronkhorstspruit, Mamelodi, because I was participating. And some were linked, but let me tell you what is surprising. Young people didn't want to be linked into formal training. We had Department of Education. We started training them on how to write CVs. We had what is it called? The Harambe project in Gauteng to come and train them. We had a lot of organizations that we brought in so that they can assist young people to look at how they can be assisted to be linked. And a very few in terms of that program, because when we started, it was not paying. It was saying gain skills. Let's see where you are. Do you have a metric? Do you have a CV? Do you know how to write a CV? Do you know how to conduct yourself in an interview? And a lot of them, for whatever reason, dropped, but a few were interested and they went through. So I think one other thing is that in terms of the programs that we are bringing for people to leave this dependency, we also have to encourage mostly our young people to try also and take advantage of these, because once people receive these, you find that when we are trying to take them away from poverty, people have already gained to say it's free money, I'm happy here we are. But funny enough, a few take that opportunity. For example, with the 350, we have success stories that are being told, and some are in the social media. You might have seen, for example, Mzansi food. We have got a few of the young people that have taken the 350 and have made sure that they start something. They've started project in farming. There's a lady in Northwest who was being flighted there. There's one who started a farming project in KZN. There's another one who sent us many lovely letters saying, I've taken a license and now I am able to assist my family and I'll get a driver's license and I'll be independent. Some of these things government can drive, but individuals should have that drive and determination within themselves to be able to say, I want to live where I am and leave poverty and better myself. Lastly, we are in partnership with NSFAS. For example, priority among funding it's given to people that are getting child support grant. We have a program where annually we take all our child support grant and foster care grant recipients with NSFAS, and if they have applied for the bursaries, they are given a first preference and priority. So those are some of the initiatives that government is saying, I'm wanting you to leave the dependency and social grants so that you are able in a year or two to be independent of social grant. Lastly, the school uniform that we are linking co-ops. And the purpose is exactly to say women that are in child support grant, that are receiving any grant, can be able to sustain themselves and participate in the economy. However, voila, do you know who are participating in the co-ops? It's elderly persons. Young people refuse. We give training, we link to NDA, but young people do not want to. You find it's elderly women that are participating in these programs. With that, let's encourage each other. Portia, go out there, interact with us. If you're interested, there's information. We are very ever willing as government. We liaise with municipality. We link our beneficiaries to all the programs that are available in government. Thank you.
Thank you very much, Honorable panelists, for that insightful information. Without any waste of time, I'm quickly welcoming Honorable Lesego Mabunda to also give a message of support. I give you 2 minutes, sir.
No, thank you very much, Dr. Dihamela, and thank you to your panelists. I think one would have richly imbibed from their wisdom and would have learned a lot. One would have also have learned so much from the questions that were asked by your guests in the program. And I think that will be some of the things that we'll have to inculcate going forward. But also listening very much carefully to the kind of questions that are asked, and it also informs us of the amount of work that we must do, Doctor, in reaching out to our people and ensuring that they hear the message. Because much is that there's a lot of indoctrination of a lot of kinds, whether it's a religious indoctrination, and also you have a lot of skepticism spread by people who utilize social media and other networks to actually discourage our people from vaccinating and becoming vulnerable. And these are some of the things we need to speak about. But our message from the Housing GPL Men's Forum is simple. Ours is to say that, and then I think this is what is shared and echoed by a lot of your panelists. I mean, we have stats, and stats and science, they speak to us. What are they saying? They are saying that victims of the bestiality of men are women, that victims of gender-based violence and femicides are women, and the perpetrators are men. And you have all resources by government, NGOs, and civil society focused on one thing. And this is what we've been doing. And we thought that it will be an antidote, or it will decrease the numbers, or it will end the scourge, or what President Ramaphosa terms as the second pandemic in South Africa of gender-based violence. I think we focus on victims. We've been focusing on women. A woman can go to a women empowerment conference and arrive at home, be beaten or killed and raped. Women who are seated in this platform, they can arrive at home and they can still be raped and beaten. So you are empowering the victim, and which is good. But what about the perpetrators? We are saying that we need to look at this with a fresh pair of eyes. We need to look at it differently. We need to start doing work, and that's what the GPL Men's Forum is doing. We need to start doing work on on the boy child, because the very same statistics tell us that the men or boys in this country are raised by single mothers. Single mothers do their best, they do their all in rearing the boys. But then on the streets, these boys are taught that women are sex objects. They're told that the only way to resolve problems in a relationship, in a marriage, is to beat up a woman. They are told that the women amount to nothing. And as a result, and that's why this bestiality committed against women by men is not ending. Everybody, you can put 1,000 brigades in Sagana. I heard somebody complaining about 8. You can even create dedicated courts and all sorts of things. It will not end unless you start speaking to the perpetrators, unless you start having civil society, and unless you start having government, and unless you start having NGOs focusing on the statistics that are screaming at our faces, telling us that over 70% of the boy childs are raised by women. We need to do that. When we had a camp, we had what we termed the father and son camp as the GPL Men's Forum.
As it goes, Honorable Member.
Yeah. When we had a camp, thanks, Doctor. When we had a camp, we asked men to climb on top of the mountain and to start having discussions. And what came out was very shocking. And it was a lesson that we need to go there, tell fathers who have sons to be close to them, and those who are like me, who only have girl children, to adopt sons in their communities, so that we begin to speak to the boy child. Thank you very much for the invite. I learned a lot from your panelist, Doctor, and thank you very much.
Thank you very much, Honorable Member Lisego. I think this discussion should not end here, because what you are also raising is very, very empowering, and we need to take it further between the Women's Caucus and from your side as you are leading the gentlemen in the legislature. Is very, very, very much appreciated. I'm going to ask each member to just one minute closing remarks. I will start with dear sister who was speaking about vaccination. Closing remarks, my dear.
Honorable Chair and honorable members, my closing remarks are simply to say, please get vaccinated. Let us get life back on the road as we know it to be, and let us keep safe and be safe at all times. Thank you.
Thank you very much. Can I welcome the gentleman, Mr. Ngomani? Sorry, I missed other names, Mara. I will get them because this is not the last time we are interacting. Mr. Ngomani, your closing remarks?
Thank you, sir. I would like to reiterate the first statement I anchored that for evil to prevail, it is for good people to sit back and do nothing. Let us stand up against GBV as a society. Let us do something in our little corners, in our little communities, in our families, but let us do something. Thank you.
Thank you very much, Mr. Ngomani. This is not the last time we are interacting. Your valuable inputs are very much welcomed. Let me welcome my dear sister from Social Development regarding grants. You are welcome, sister. 1 minute to do your closing remarks.
Thank you, Doc. It's still Sasa. Yes, we are the daughter or son of social development. Yes, Doc. I just want to say thank you to the Gauteng legislature for this opportunity. And I think, as mostly said, when you look at the questions, there's more to be done, and we need such dialogue. And I think as we empower women, and we look at how best we empower them. Information, I think, is power, because we realized, for example, with the top up that was given by government after men, which is one part of the abuse, by the way, which is the financial abuse. Once that top up was introduced last year, every mother who came to apply for a child support grant was bringing a man, because men started saying, now we are going to get additional 500, come, let me bring you. So I think such dialogues also empower us from the government in terms of saying, as we introduce services, what are we encouraging? Because it also now open our eyes to say there is another part of abuse that is being perpetrated, which is that of financial abuse. Thank you.
Thank you very, very, very much, our panelists. You really empowered all of us here in this meeting. We also would like to extend a thank you to participants. We have heard you. What you have raised is very important, and we plan to take it forward. We should have similar messages as government. It is very important because it is empowering when we speak using the same message all the time. Many voices, same message is key for us. Research is encouraged, and I think many of us are research shy. It's about time we do a lot of research. COVID-19 has brought a lot of opportunity for us, including the legislature, on the side of men and on the side of women, and together to do research. We are available to assist. At least we were exposed to some research. That is why we are called doctor today. So we really are going to encourage together with the leadership of the women's sector, to ensure that this does not end here. We have learned a lot, and our panelists, this is not the end that you see us. We need to continue working together so that we are at the end having an empowered society. Things have changed now. It's no longer, we can't operate with the same ideas after so many years we are in the democracy. Certain things are still working, but a lot of things are no longer applicable. Job opportunities are very reduced. We need to come up with ideas as to how can we empower women to do something. Many, they can do something for themselves, and we appreciate that. But the issue of education on business management is key. The issues that were raised in this meeting, all of them are very important, and we are going to take it forward. Thank you, Member Makubela, also for gracing our meeting. Next time we will give you more time so that we hear a lot of the important things you are doing. We saw messages previously posted in the legislature emails. Now we are empowered. And just to also indicate that the vaccine gives a boost in the human body, so that if you are attacked by the COVID, your body is better prepared. So it's very important. We have learned a lot. I also thank the leadership of the legislature, Mr. Nontonga, Mr. Makamba, all of the leadership there led by Mr. Skosana. We appreciate it very much for the support you have given. We will take the message to our women's leadership. We can do this every quarter, maybe as we are starting, because a lot of things still need to be done. Thank you, everybody. The meeting is adjourned. Bye-bye.
Bye.
Thank you, Doc.
Thank you, everybody.
Thank you, everybody. Bye-bye.
Okay, goodbye.
Bye.